Okay.
Hello, everyone. My name is Karen Ogoti. I'm a director for Children's Services in the Department of Children, Ministry of Labor and Social Protection, Kenya. I'm going to take you through care reform in Kenya as an introduction for the virtual study tour. Kindly, I will take some little time also to explain a few things that are not clear or that are summarized. So I'll give you a profile of Kenya as a country. We have a total population of about 49.6 million, and our child population of that is 49%. From this population, we have the kinship care of 3.2 million children who are under kinship care. So that tells us that many children are under the care of related parents from their families. We also have about 4,000 children who are under foster care. And for the children who are living and working on the streets, we have a survey that was done, and we found out that we have about 17,000 children who are living in and working on the streets. We have also those that have are on domestic adoption. This is for Kenyans who have adopted children, and the number of those children could be, a second, I'll get it, around 800 per year. These are the children that are placed under domestic adoption per year. Then we have the intercountry and foreign adoptions. Currently, we are not doing any intercountry adoptions because we have a moratorium, which is hindering us from placing any child under international or intercountry adoption. We have a program which is also supporting children, which is called the Orphans and Vulnerable Children Cash Transfer Program, where we are supporting around 353,000 households are receiving cash transfer. And this is because they have children who have either one or two parents who are not alive. And that is our criteria to these households. On the child care in Kenya, we have the residential care, where we have about 40,000 children to 45 who are in registered charitable children institutions. And this is prior to COVID. So before COVID, we had about 40 to 45,000 children who are in our institutions. And when you talk about the institutions in Kenya, we are talking about those that are in private or charitable children institutions or statutory, which are run by governments. And those that are in government are about 1,500 children that have been placed through the courts. Now, we have a history of COVID, and I think every country is now going through that. So when we had that experience of COVID, the government gave a directive to reintegrate children from institutions to the community. And these children had to move from institutions to the community so that they can be taken care of by the community. But initially, they were more in the institutions where they have been staying as part of their home. And this led to about 42% reduction in the numbers of children in the registered facilities. So that gives us about 20,000 children who are in the institutions who are reintegrated to their community. Out of these children, the 20,000, 15,000 were integrated to alternative family care, not mainly to their biological parents, but to their relatives and to their guardians. But out of that, 5,000 were integrated or joined their biological parents. And that tells us that we have children who are in institutions who are biological parents, and not only orphans that are actually with their parents, I mean, in the institutions. Now, we have what we call the care reform in Kenya components. There are 3 components when you talk of a care reform. One is where we want to prevent, we are preventing and preserving families so that children don't move away from the community. And that's what we call prevention and family preservation. We also have transforming the institutional care. As I've mentioned, we have had children who have been in institutions, and we are now transforming them from the institutions to the community. And as we do that, we have a process. It's a process that we are following to transform so that we don't just pick children from the institutions and straight away integrate them to the community. We have to do a process which will enable the children stay in the community without going back to the institutions. Then we also have alternative care where we need children to stay with the relatives and the guardians and any other person who would want to take care of these children without taking them back, to the institution. So that is where we have other alternative care options. Now, in our care reform in Kenya, we have a journey, and the journey is as far back as 2001. In 2001, we reviewed or looked at the Children's Act, which sets out the right to parental care and regulates foster and the residential care. So from the previous act, we changed this, and now there was a new law in 2001, which actually took a lot of focus on the child rights and to parental care. Then in 2004, we introduced the cash transfer. This is the time the cash transfer was introduced because we had so many orphans who needed alternative care, and many children were staying alone. So the country realized there's need to have an alternative way of taking care of these children so that they can be retained in the communities. The families taking care of them were given some cash to support them so that they can also sustain them in the community. Then we moved on to 2010, where we had a new constitution. Our constitution was reviewed, and we had a new constitution which outlines the rights to parental care and also provided for social security. The social security we are talking about is currently now known as the Inua Jamii, where we are focusing on supporting the children who are in the families. There are those with the elderly, there are those who are living with disability, and there are those who are orphans. So this Inua Jamii is a component of many cash transfers to children who are vulnerable in the community. Then in 2013, we came up with the national standards. We developed national standards for best practices in residential care. These are the institutions. And after that, we issued and trained the staff in those institutions on how to implement the national standards, because there is a lot that they needed to change from their previous practice. In 2014, we developed the guidelines for alternative family care for children, which actually was calling for reduction in residential care, trying to limit the number of children who are going to the institutions, and at the same time, trying to release those who are already in the residential care to the community. And this is where now we introduced the continuum of care. And this time again, there was the moratorium on the inter-country adoption, which I've already mentioned. And that is where we felt that there is need as a country to first look at the practices that are going on inter-country adoption, so that we review and put policies in place to improve on each area where we are dealing with the inter-country adoption. So up to this point, we have not lifted the moratorium. We are still trying to improve the structures and any other policies that are in place. Now, in 2017, there was a suspension of new residential care facilities. Initially, we were registering so many institutions, and also kind of the monitoring of those residential care was not very, we were not very keen on that. So there was a suspension of registering any new charitable children institution or any residential care. But again, we emphasized or put a lot of effort on ensuring that the existing residential care facilities are monitored and are implementing the national standards which were developed earlier. So at this time again, we started implementing the guidelines for the alternative family care in the counties. Now at the counties also we have the sub-counties. Those are the ones which are now called the district, which used to be called the district levels. So there's a pilot which started in 2017 around the month of May. And from that time, we've been implementing that pilot. It's supposed to end anytime this year around June. Then we can now do the scale up to all the other counties after we have ensured that the process has been done well. 2019, we established the multi-agency core team, which is to coordinate the care reform. And this is under the NCCS, that's the National Council for Children's Services. This is the body that is mandated to ensure that there is a coordination on the care reform, and that is why it is actually coordinated under the National Council for Children's Services. Now in 2020, the government also followed the directive that children should be reintegrated from residential care due to COVID. Remember, this is the time now COVID actually was becoming a pandemic in around the month of March, mid to April. We started ensuring that children are going back to the community from the residential care. Now, there was also the issue of the case management for integration, which was published, and some families are using, some families are receiving an emergency cash transfer courtesy of UNICEF, and also changing the way we care, that is the CRS. So some of the families that received children in their families had to get some support so that we cushion them not to allow children to go back to the institutions or to the residential care where they were before the COVID-19. Now, we also developed some key messages which were supporting the caregivers during the COVID-19. The messages were to help and to guide the families that are supporting the children who have left the residential care, and even those who are already with those children. Then we had a process for developing a 10-year national care reform strategy, which is going to guide the stakeholders in the area of care reform. So we are in the process of developing this, and we are about to finalize. This is a process that is led by the National Council for Children's Services, and all the stakeholders are participating. Now, 2021, you realize we have a draft children bill, and in 2001, we had an act which was repealed from an earlier act, which was 144, cap 141. Now, again, we want to repeal this act because we realize there are many areas that we need to address issues of children. So we have a process which has been going on for almost 10 years now. And the draft children's bill is now endorsed at the cabinet level, which includes limits the use of residential care. We have tried in that bill to ensure that we are limiting children from going to the residential care, especially for the under 3 years old, and also the regulations on foster care and adoption and gatekeeping proceedings are also emphasized in this bill. So when it becomes a law, we are sure the issues of children issues to the residential care will be addressed. The there are many other policies that have been developed and guidelines which are being developed, especially the standard operating procedures on alternative family care and community-based care, aftercare support, and also family strengthening and gatekeeping. This is not just done by the government, but by all the other stakeholders who are very key in care reform. So they are supporting the development of all these policies and guidelines, and the government is leading the process. Now, we have some achievements as a country on care reforms. I'll mention some of them. For example, we have developed policies and guidelines on alternative care or on care reform, and this is a big achievement because we can now make reference to them. They have been launched, some of them are in the process of being launched, some are being implemented. There is also a highly participatory process for developing the new 10-year national strategy on care reform. We have about 120 stakeholders or groups that are participating in this, and this tells you that we are getting views from all over the stakeholders. We'll also not forget to involve the children in this before we finalize the process. There's also an evidence-based for reform. For example, through the care system assessment, which has examined all aspects of the care system so that we are informed on whatever we are including in the strategy. There is also the establishment of the care reform core team for coordinating the reform, which I've also mentioned. It is being led by the National Council for Children's Services. There's a very vibrant core team on this. There's also the successful demonstration of care reform at the county level for future replication and scale up. As I said earlier, we started the pilot in 2017, and at the moment we are about to come to the end of the pilot period, which was 3 years. So we will now scale up to all the other counties. That is the 47 counties, because we have now lessons learned and we know what to improve on and what not to carry forward with us. So that will inform us as we do the scale ups. Now, the OVC, the orphans and the vulnerable cash transfer and other family strengthening measures are now in place. We have so many other programs that are supporting children who are in families, especially those who have no parents. And the support is also coming not just from the government, but also from other stakeholders. For example, as I've mentioned, UNICEF is supporting the changing the way we care. It's also supporting. We also have the SOS that is also giving some support to families in some counties, one of them being Busia and Kisumu. There's also the development of a cash management tools to support the family reintegration. These are tools that we are using to make reference as we reintegrate children to the community or to the families. Now, the civil societies led organizations have led work to prevent separation in highly vulnerable families to ensure that these children do not move away from the families, but also are supported as they stay in these families. That is now sustainability. Now, there's also the transformation of several residential care facilities to centers that provide support to families in the community. We are ensuring that those residential care facilities which were taking care of children and not really letting them go to the community or allowing children to go back to the community through their integration process, again, transforming these facilities to other relevant, providing relevant services to the children around the communities where they are located. There's a strong National Association of Caregivers who contribute to the national and international level care reform. We realize that these are the right people to talk about in the residential care because they have had experience, they have stayed in the institutions, and they can give us the right experience and the harm, the cause they have gone through while they are in institutions. So we have tried to bring them on board as we move on with the care reform process in the country. Now, we have some challenges still. As I told you, this is a journey which started in 2001. And as we move on, we have had some challenges, which we are also struggling as we move on to the achievements. We have a norm that people perceive residential care as a norm, and they accept it, that children are okay in the institutions. So trying to change the perception of people from this is very difficult, but again, we keep on creating advocacy and trying to bring out the really effects of children staying in the institutions. And that's why we have brought on board the caregivers who have gone through these experiences. There's also resistance from the operators and the staff and the community of these residential care facilities. Most of them, this is their lifeline, and they are fearing that if the institutions are maybe closed or if we remove all the children to the institutions, they fear that at some point they may lose their earnings, they may lose their lifelines. So we are getting some resistance, but I know by end of it, we'll be able, all of us, to focus on community support and not residential care. As I said earlier, we'll transform these facilities to provide or offer other services. Many children, many child protection practitioners and donors are unaware of the harm which is caused to children in care. Some of them feel that really what they're providing to children in the residential care is the best, but later on you realize there are some negative impacts, which is very detrimental to the growth of many children. So many of them are not aware, and that is why we are trying to create awareness, trying to do so many researches so that we can get the truth, the really truth about residential care. There is inadequate formal daycare and respite care services in the country, and this makes it very difficult for some people to take on board children who are not belong to their families. There's lack of a well-developed foster care system, and that's what we are trying to improve on right now as a country, so that we have a foster care system that can also encourage families to take on board children who need temporary shelter, especially those whose families are not stable for a certain period. Orphanage, volunteerism, and trafficking is another problem, which is a challenge. So the vulnerable children are lured into care homes, and this attracts the volunteers and the donations they bring, because they use this as a reason for having children in the residential care. Now, I will just briefly talk about the care reform components, our future focus. And one, from the prevention and family preservation component, we are focusing on enhancing social support services, where we are collaborating with the social assistance unit. This is where we have the Inua Jamii, which I mentioned earlier, supporting the elderly who have also children who need support, the supporting those children who are living with disability, and also the children who are orphaned. So this is the unit in the government that is supporting those vulnerable families. We are also collaborating with the Social Development Department in the development of the family policy, which is actually now finalized, so that this is the policy which will guide on building a strong family, which will enable children to stay in the community. And we know the family is the smallest unit that we need to work on, so that as when a family is strong, we know children will also be retained in the community. This the development of gatekeeping guidelines. We have finalized this. We are waiting to launch, and this will be the guidelines will support or enable the stakeholders to make reference to as they implement the care reforms. We also are focusing on sensitization and awareness creation on care reform. This is very key because we realize many people do not understand or they don't know the harm that is caused by children being in the residential care. There is a provision of positive parenting information to caregivers and stakeholders. This is support that we'll be getting from many stakeholders. And once we have families that have positive parenting information, many children will be able to be retained in the families and in the community. Now, on alternative care, we are focusing on training the key stakeholders on alternative family care so that they understand their role in the area of care reform. We also developed the standard operating procedures, which I've mentioned earlier. We have finalized. We are also waiting to launch the document. We have developed the foster care guidelines, which will also enable us to make reference to areas of foster care in the families. There's also a baseline survey on children in alternative care, which has been done, and this is informing us on issues of alternative care in some counties, and it's giving us the picture of care reform in the community and in the institutions. And also we have the assessment of the child care systems in Kenya. As I told you, we are also developing the strategy. So this assessment is informing the development of the strategy. And finally, we have the transforming of the institutional care, where we are focusing on training case workers and also the case managers on case of management. For them to do a thorough integration, they have to be trained so that they understand case management for each child. There's also the enhancing of tracing and follow-up services for children. As we do the integration, we also need to trace the homes of these children, and as we place them, we have to do the follow-up. So this is our focus. It's also the development of transition guidelines for the institutions. There is the enhanced aftercare support services for children and the young adults. For example, we need to give them life skills. This will enable the children also, apart from being supported, they also need to have their own life skills to stay in the community. There is the national situation analysis of children in institutions, which has been done in 5 counties. That is Kisumu, Nyamira, Murang'a, and Kilifi, and Nyamira. So this analysis has informed us on the situations that are on the ground. They're not the same. Each county has different issues, and this is helping us to know which issues to address in each county for children as far as care reform is concerned. We also have assessment of the social workforce, which has been supported also by UNICEF and other partners. So we have even reached the point of training social workers with our Kenya School of Government, and this is helping us a lot to prepare people to assist the children. Now, the overall overarching care reform future focus is 1, development of the national strategy on care reform, which is a 10-year plan. There's also the enhancing advocacy around care reform we realize when people are not understanding care reforms and especially issues of alternative family care. And the main one is where they don't really understand what to do when it comes to adoption and other options of alternative care. Also, we have our future focus is documentation of the care reform processes. We need documentation where we can talk about the process from the beginning to the end, so that in future, as we scale up, we're able to talk about lessons learned, the challenges, the achievements, and any other processes that we are taking as we move on. Now, we are enhancing the care reform data management, because once we get all the children who are going through alternative care, we will be able to talk about this in other country. So we are improving our child protection management information system to be able to capture the care reform indicators. And these are the indicators that will pick every child that is going through alternative family care. There's also enhancing public-private partnership. The government cannot do everything alone. So we are trying to bring all the partners who are relevant in this process so that we are able to build a strong team that can carry forward the care reform process. We are also enhancing coordination on care reform. As I mentioned, like now the National Council for Children's Services is leading in the development of the national strategy. We also have come up with a multi-agency core team. So this is the coordination that we are talking about. And the Department of Children's Services is also leading in the implementation of the care reform process. And this is where we feel once there is a strong team that is leading the coordination, then we are able to achieve whatever we are focusing on. I will say that there is no such a thing as an orphan in Africa. And in Africa, the home is never full. So it is clear that a child, it takes a village to raise a child. So you cannot raise a child as an individual. Thank you for listening to me.